Hey, Dr. Chris Gubbels here from Square One, and today I want to explain to you briefly why people get injured easily in car crashes, particularly even car crashes where there's not a lot of car damage and probably even at lower speeds. And it has to do with the certain type of injuries. We're talking about soft tissue injuries here, ligaments, things like that. So first of all, a couple of terms you need to understand. You need to understand stress and strain. Now, what stress is like the measure of the amount of force being putting into something, right? It's how hard or something's pulled or pushed or whatever. That's like a measure of like the magnitude. Strain is how the properties of the materials deform. Take a ligament or a muscle, if you stretch it and it changes shape, that and the properties of that would actually be strain. Now, let's talk about these injuries. First of all, most injuries in car crashes happen over a very, very short time frame. We're talking like fractions of a second. Most are going to happen into like 1/10, maybe 2, maybe at the most 3/10. So most are like in between 1 and 2/10 of a second. So it's like fractions of a second. These injuries are extremely, extremely fast. All right, you have to know that. These are going to happen faster than you can actually physically contract a muscle. The second thing has to do with the materials involved. And the word you need to understand is something called viscoelasticity. And that explains the properties of these like ligaments, things that get injured a lot. Now, viscoelastic properties or viscoelastic tissues, how fast that they deform makes a difference in what happens to them. And so you could have ligaments that can withstand hundreds of pounds of pressure, right? If they're stretched little by little by little by little, okay? But what happens is if you put the force over them very, very rapidly, they react differently and they cannot withstand that. So imagine this piece of Play-Doh represents a ligament. And if I take this and I put a certain amount of force on it and I do this slowly, this is going to slowly elongate, it's going to stretch, and it's going to change shape, just little by little, okay? So that's this little bit of time. Now if I take the same piece of Play-Doh, we're going to say the same ligament, and I put a force over it, but I put it very rapidly, here is what happens. Take that, boom, it breaks, okay? Most injuries, I say most, a lot of injuries that happen in car crashes, like say in a neck injury, you don't even exceed the normal range of motion. But what happens is because they're so fast and the ligaments can't respond to that because they have viscoelastic properties, these tissues rip or tear instead of just stretching naturally. If you take your neck and you just naturally move the range of motion, it's very slow, tissues stretch and they go back. But when you do it very fast, boom, the tissues rip or tear. And most of the time these are what's called a subcellular injury. They're not a complete, like they don't rip off the bone most of the time. A way to look at this is to say you had 100 different fibers, maybe 15 of those fibers are damaged or something like that. And I'll talk more about that in another blog, but this is why you get a lot of injuries even at low speeds. It's because one, the injuries happen so fast, and two, like literally fractions of a second. Two, it's the properties. Ligaments are viscoelastic, which means the rate or the speed at which the time involved. And so when there's less time and it's very fast, they react differently and they actually get damaged and they break compared to very slow where they get stretched. And that can even happen without the joint exceeding normal ranges of motion. So Dr. Chris Gubbels here from Square One, and hope you look forward to watching some of our other videos on injuries and how we fix these things.